Welcome to my 10-minute sequence for morning sickness in pregnancy. Now, this is something that affects a lot of women. It certainly affected me very badly. And we often feel that we can't come to our yoga mat or we can't practice because of the overwhelming feelings of nausea, as well as other things that we might experience, such as, heartburn or pelvic pain, general discomfort, and getting used to this big bump that we have as well. Okay, so I'm going to take you through 5 postures that you can practice in any order at any time of day. I have a bolster. You can use a rolled up blanket or towel or cushions instead, but join me now in this practice. And first of all, we are going to begin with puppy pose, which is absolutely gorgeous. This one's nice for heartburn as well. So we're very gently going to come on to all fours onto tabletop position, making sure we have a nice space between the hands and the knees. Okay, so hands should be underneath the shoulders, knees underneath the hips. So we're just going to warm up that spine to begin with. Just looking up between the third eye, between the eyebrows, taking the navel down to the mat. And then reversing that curl, curling all the way, looking towards the navel now, arching that back up like a cat. And as we inhale, reversing again. Okay. Just looking up between the eyebrows. And reverse. Now, because we're pregnant, we're not going to take this too extreme. You don't have to push right up like a cat. This is comfortable here, that's absolutely fine, okay? Now, being aware of the weight of the belly as well, when we take the navel down, being aware of how that feels on the lower back too. And on the inhale, exhale. Exhaling, looking into the navel. Inhaling, looking up. Now remember, if this arch is too much for you because of the weight of your bump, just holding it here, okay? And this movement can be as small as you need it to be. So this is just to warm up the spine and to get us started before we move in to puppy pose or supported puppy. Now you can use your bolster or block here, or again you can do this with your rolled up blanket, your cushions, your blocks, or just on the mat itself, okay? So we're going to come into puppy pose here. We're just going to come down, so we've still got these knees hip width apart or wider if you have to accommodate your bump. And we're going to come on to the forearms, okay? Now, we do need some kind of support here, so either the block, the bolster, something rolled up. And we're just going to pop the forehead here. And we're just going to place the forearms on the mat, okay? So just allowing the chest and our baby bump to roll down towards the mat. And just close your eyes and relax. Okay, now we can unturn those toes. We can take the knees back if that's what's available to us. This is a nice pregnancy variation of puppy pose. So obviously we can't get the chest all the way down to the ground because there is a baby and a bump in the way. But this can be really nice for nausea, heartburn too. Just taking a few breaths here, in and out through the nose. Now remember, don't be afraid to use blankets and props underneath the knees for comfort, or doubling up your yoga mat for a bit more support as well. You can also place a cushion underneath your bump for extra support if you want that too, okay? Just taking a few breaths here. Allowing any feelings of nausea to leave the body. Focusing on the breath, which itself can help alleviate those symptoms. Those waves of nausea. Let them go. Just breathing in and out through the nose. Another option is to stay on the elbows and place the head and the hands on the forehead, if this is what's comfortable or available if you don't have props, okay? And you can hold this posture for as long as you like. So then we're going to move in to supported child's pose. So we're just going to pop back into hero, realign ourselves. Now for this one, guys, I would like you to use a bolster, blocks, cushions, whatever you want. And we are going to take the knees slightly wider apart. Now, obviously, if we are suffering from pelvic girdle pain, we're going to keep those knees slightly more together, about hip width apart, no more than that. But if you have the availability, take the knees apart to accommodate your baby bump, all right? And we're just going to bring the bolster in front of us and just move up and down until you get the right size to accommodate your bump. And we're just going to walk those elbows forward, place those hands either side of the mat or holding onto the mat, and just to place the head on the mat. And this is supported child's pose, Urdhva Balasana. So the hands can be flat on the mat, you can be holding onto the bolster, whatever is comfortable for you. And remember, take those knees as wide apart as you need to. Forehead can be on the bolster, or you can look to either side. Don't be afraid to move about to make sure that you're nice and comfortable. Remember, this is about relieving nausea. And remembering to slow down the breath, in and out through the nose. Inhale, equaling the exhale. And just bring awareness to those feelings of nausea, but let them pass. And again, you can hold this position for as long as you want to. And when you're ready to move into the next position, we're going to pop over into reclined hero pose. So this is our hero pose, seated hero pose. And we're going to come into our reclined hero here. Okay, so what we're going to do is we're going to actually slip the feet down so that the front of the feet are on the mat at either side of the thighs. Now, if this is too much for you, if this is really uncomfortable, you're feeling pain in the knees, that's absolutely okay. Now again, you can take cushions for some support here, all right? If you want to stay here, that's absolutely fine too. Or we can walk our way back onto the elbows, making sure that the bolster or your rolled up blanket is just at the base of the spine and just gently supporting yourself on your elbows and forearms. Allow yourself to come back. Allow the palms to face upwards. Allow the shoulders to fall back. Okay. Then the knees should be about hip width apart. And just relax. Now, if this is too uncomfortable for you, you still want to enjoy the benefits of reclining, just pop back up onto the forearms and the hands. Bring those feet round to the front again. And you can just simply place the feet flat on the mat and roll yourself back onto the bolster. Okay, so wherever you're comfortable. Just breathing in and out through the nose. Bring awareness to what you feel in the body. And just enjoying the release. You can actually add in some extra cushions and bolsters for this one as well, because some of us, when we're suffering from morning sickness, being fully reclined can make us feel super nauseous. So if the more height we have, the more comfortable we become. Okay, so we can take it a bit higher if that's what's going to make us comfortable, because the whole point of this sequence is to relieve that nausea. Remember, those feet can be flat on the ground too. And just rolling back, allowing the head to rest on the bolsters and props. Palms facing the sky. Taking a few deep breaths here. Again, you can stay in this pose as long as you want to. When we're coming out, we're just popping up onto those hands, onto the forearms, and coming back up to seated position. Okay. From here, we're going to come back into Supta Baddha Konasana, or reclined cobbler's pose, or reclined butterfly. We're going to take the soles of the feet together. Now, they can be as close to the groin, as far away from the groin as is comfortable for you. Okay, this is not a competition. This is about alleviating nausea. And we're pregnant, so we have to respect our new limitations. Again, avoid the urge to overstretch. So if in the past those heels didn't come way up here close to the groin and now they do, I would say avoid, avoid, avoid. We don't want to overstretch, as we can be hyperflexible because of all the elastin that we have in our body, so that the pelvis can open up for giving birth. All right. So again, we're going to come back, having the soles of the feet together, and you can play around with that, take them back and forth, whatever's comfortable. Coming back onto the hands, rolling back again, finding the base of the spine and allowing yourself to roll back and just relax into Supta Baddha Konasana. You can be using, if you're finding that hips are quite tight, you can be using bolsters, pillows, blocks under those knees to support them, and those knees can be as high as you like, okay? They don't have to be all the way down here, so don't panic if they're not. I'm just taking a few deep breaths here. Inhale, equaling the exhale. Allowing the hips to open, breathing down into the hips, the pelvis. Just imagining yourself breathing all the way down. With each exhale, the hips just opening slightly more. And you can pause here, stay in this posture if you want, or you can bring the knees together. You can use your hands to do that, and then gently popping on the fingertips, popping yourself up nice and slowly. And now we're going to come into Viparita Karani, or legs up the wall pose, my personal favourite for me. So again, we can be using, I'm going to demonstrate the other way because my wall is over here. Just come forward a bit. Okay, so using our bolster here, okay, we can keep that as high or as low as we want. If we're okay without a prop, that's absolutely fine. But obviously, when we're pregnant, we don't want to be lying directly flat on the mat. So some kind of prop is always good. Okay, so from here, again, just placing that bolster at the bottom of the spine, rolling ourselves nice and gently back, using the hands and the forearms if required, and placing the feet up on your wall or cupboard, as we have here. Okay, you can take those feet as wide apart as you like. I wouldn't recommend any further than hip width apart. That's absolutely fine. Placing the back of the hands on the mat. Just allow the feet, the toes to relax. Allow the feet to rest on the wall or the chair. And just breathe. Relax the muscles of the face. Allow the tongue to lie limp in the mouth. Just breathing through any waves of nausea, bringing your awareness to that. And just relax. Now you can stay here for your Savasana, or you can actually take the feet flat against the wall here as well, okay? Again, don't be afraid to play with the height of your bolster or how many pillows and bolsters you're using. Just make sure that you're nice and comfortable, very important in pregnancy, okay? And just rest here as long as you want to. This is Viparita Karani, legs up the wall pose. And when you're ready, gently walk those feet back down. And when we're pregnant, we always roll on to the right side, come onto the forearms, and back to seated position. Namaste.